Great. Thanks for the introduction, Lars, and thanks for the invitation to speak as a keynote speaker of this conference. The title of my presentation is Patient Perspective, and then both a patient and engineering perspective on digitalization, data, and AI for health. My name is Hanna Svensson. I'm a Master of Science in Applied Physics, and I worked in the industry for about 10 years with telecom and automotive development, mainly with algorithms and data. I'm also a Swedish e-patient or patient advocate, and I've been for the last couple of years. I live with diabetes type 1 since more than 30 years ago, and since about 4 years ago, I also live with rheumatoid arthritis.
Hanna, I think you need to adjust the image a little bit on your screen.
Aha, is it big now?
No, we see some text behind it.
Aha.
Now it's perfect.
Okay, then I need to have it on my second screen. Today I work with the measurement quality at RISE, where we measure soft variables such as quality of life or fatigue and measures like that. So, as I said, I live with my patient's perspective comes from those things. I live 24/7 with a thought in my mind that I need to regulate my glucose levels. There are some things that make it rise, and there are some things that makes it go down. This means that I always have to carry a lot of things. I always have to plan in advance what I will do, and so on. And those are things that I do at work. I do it when I'm out in the forest with my horse, and I do it when I'm out on the sea kayaking. It's a 24/7 tasks. As I said, I work at RISE, and I just want to mention a few things about RISE. It's the abbreviation stands for Research Institute of Sweden, and my group is working with this. How can we use human being as a measurement instrument to understand more things than we can with ordinary physical measurements? So the agenda and topics for today, I will talk a little bit about health and self-care, and then go through a report I've written about health data, and then some conclusions about how we can learn from data. So just to put in like the correct focus, the things that are important for us as individuals is our health and the health of our loved ones. So where does health come from? This is an American study showing what gives health for an individual. And we can see that the biggest circle here is genetic and social circumstances. And second biggest one is behavioral patterns such as self-care. And then the smallest one is healthcare, which only gives, it's only 10%. So when we want to increase the health of our citizens, we need to understand this picture and see that healthcare is not the only way of creating health. So one of those things were self-care. And I want to stop a little bit here and give you some thoughts about what is self-care. I asked several other e-patients in Sweden about their view of self-care. And I found those 6 common things that people are doing. It's a lot about organization. It's about taking your medicine, but this is like the smallest part. It's about discipline and not doing a lot of stuff that you want to do. It's a lot about measurement and adjustment of treatments. It's about exercise and estimation of symptoms. And this is a task that we do 24/7, as I said. So on your right side here, you can see a picture with 8,765 dots, each representing 1 hour in the year. Out of this patient, a colleague of mine, Sara Riggare, spent 1 hour with her physician. So 1 hour out of 8,700 is healthcare. And that's why it's so important to not only see healthcare as the thing that gives us health. And the second thing to just keep in mind is that we are all persons and we are all working differently. So no one will act and think the same of any treatment, even if we have a study that says that, okay, it works for most of the people. When it comes down to the individual level, it could still not work or just not fit into that individual's life and schedule. So what is health data? Another picture with a lot of dots. This is 96,000 dots, each representing 1 point of health data for my own, from my personal health data. So if we zoom down, for every day I collect a lot of glucose level measurements, which is the solid line here. I also collect pulse measurements. And then I try to track my mode every day to see how I feel. I track how much carbs I eat or I could also track the whole meal, but I've reduced it to carbohydrates. I track insulin, which I take at every meal. And I also track basal level insulin for my diabetes. I track joints in my stiffness and the symptoms of my rheumatoid arthritis. And these are things that I do every day. And life is more than just one day, so it will just keep on. And it's here where you have to try to find some patterns. So out of those 96,000 points, I have 26 points in the healthcare system. So it's just a tiny, tiny bit that exists in the healthcare system and where there are good structure information models to sort the data and try to find patterns. With that said, and the personal view, I will continue with presenting this report I've written, health data from an individual and self-care perspective. This will soon be available in English, and I think Lars will help you to find the report when it's available in English. The work consisted of a questionnaire, some interviews, and the reading of academic articles. And the question was, what is healthcare? What is health data for adults living with chronic conditions? And the main goal was to find different health data variables they were collecting, and there were no aim of finding out which one was more common and so on. So I wanted to investigate the whole space of health data variables. And during this, I found out we could group them into 4 groups. And I wouldn't say one is more common than the other, but the first one was measurements. So variables measured with available products on the market today. And then we had a group of assessments which were variables assessed by the individuals, but they were not measurable at the time. And then there were quite a lot of estimations of measurements where you did not want to make the measurement because it takes too much time, but you still wanted to save an estimation of it. And then the 4th group was self-developed tests. And those were variables that were measured in a systematic approach, but the systematic approach was developed by the user, him or herself. So some examples of this. For assessment, common variables are fatigue, pain, or stiffness. And then maybe it's just, okay, on a scale from 1 to 10, my stiffness is 2 or my stiffness is 4. For estimation of measurements, it was quite common to just estimate what you're eating, your diet and food intake, but also your exercise. For measurements, glucose level was one of them, but also body temperature or pulse. And when it came to the self-developed tests, I found out that maybe you could measure shaking with using your accelerometer on your phone, or using your phone to see how much you can tap on it in which speed to make an estimation of your movement pattern. And the motivation behind tracking all of these health data was to find out and put words and numbers on what is important for the person, for the individual. It was to, other thing was to remember daily things later. Has it been good or has it been bad? It's very hard to remember this when you come, for example, to your healthcare physician. And yeah, at the same part was to prepare for this and giving a better ground for decisions that you take together with your physician. And it was also to improve your personal health and self-care outcomes and routines. I was also curious about how much data do people want to share? Is it different if they wanted to share EMR data, healthcare data, or their self-collected health data? And there were a difference here. The number of respondents was about 200, so it's just giving you maybe like, okay, maybe we need to investigate this more. So people they wanted to share their self-collected health data for research and for their own care, but they were a bit more hesitant on sharing their EMR data for research. And this is because the EMR data consists of a lot of other people's views on your personal health. And as a second step, I started to write about a method for storing health data and what's needed for this. So today we have a lot of mobile apps. We have a lot of like diaries, which could be both in paper or in a digital form. And people are using quite a lot of many spreadsheets. So in order to have a good storage for self-collected data, I think we need some kind of process to develop your personal model for what is important for you. So starting with a generalized model, finding what's important for this individual, and then end up with a personal model. And here's an example for a personal model that would fit me, where I can store data if you are going from left to right, from activity trackers, from the quality register, the Swedish quality register for rheumatoid arthritis, from my diabetes tools, from my diet tracking, and combine those with healthcare data, which is mainly lab result and EMR notes. And then also add assessments and measurements that I do myself. For example, fatigue, mood, weight, or body temperature. And how, if we have this kind of information and data structure, then we could have a common way of connecting services on the top right corner for example, visualization and analysis. So as of today, there's no way for me to see both my pulse data and my glucose levels data, even though I know that exercising or just taking a short walk is one of the biggest things that affect my glucose levels. And in the next step, then my health. And this brings us to the third part, learning from data. What can we learn from all of these data? So I think you all recognize the Dikve pyramid, where we say that data is the source for information, and from information we can build knowledge, and knowledge can give us wisdom. So when it comes to health, if we need to see, to build knowledge for the individual and for what's really creating health for citizens, we need to see the lowest level of data as this kind of self-collected health data, and not just healthcare data. And those different kind of data comes from different perspective. From the healthcare perspective, we have data that gives us knowledge about average effect of the population. This medicine wasn't dangerous, which is like the first step when you develop a drug. It worked for 80% of the study population, got a good effect of the medication. Those are typically healthcare perspective knowledges. But on the other side, on the person's perspective, we can say great things about the effect for me as an individual, but we cannot draw conclusions how it would work for other people. So on the left side, we have answer on the question, what does the study say? How does it work for the population? And on the right side, we have this person perspective. What does my own experience and my own health data say? And then we need to combine those two perspectives in order to get a great health for the individual. And I have one personal story to tell about this. I had a really trouble biking to work a couple of years ago, and I tried everything I could figure out. I increased mainly decreasing my insulin levels, but I still couldn't. And then I met a physician that was into research about nutrition and exercise. And he said that, what I found out here is that persons living with diabetes, they can gain a lot of good benefits from eating more carbohydrates while exercising. Can't you try this? So I started to bike to work eating raisins at the same time. And this actually worked for me. So we had found out, first I found out a place where, the common structure to decrease the medicine was not working. I could, from research, find another way of doing it, and that worked for me as an individual. So when it comes to learning from data, this is quite a common question that I can see on conferences. The biggest problem on the conference is that 80% of all the healthcare data in Sweden is unstructured, and how can we structure it? But I think we need to look into more of those kind of questions. How can we help the individuals to gain knowledge from their own data? How can we help them with data collection and data aggregation from different sensors? And how can we, as a second step, help them to find patterns? I'm sorry for. So some of conclusions I want to give you is that health data is much more than just healthcare data. And in order to build this understanding, we need much more public and patient involvement in both in research and care development. And we need to start this movement onto culture change where we can see the patient in the driver's seat receiving help from healthcare, involving healthcare in their own care. And we need to see more intelligent solutions for this. And I also want to give you some how could this help? I want to connect this with digitalization, informatics, and AI, and to self-care. So digitalization of tasks in self-care, that could make things easier to do and remember, and it would probably increase the burden of the disease. And it would also make it possible to plan and coordinate and follow decided medication schemes. And informatics could give a new developed information structure that would make it easier to remember symptoms and get an overall picture that reflects what's actually happened and not just what you are remembering. And it would give a solid ground for knowledge building. And if we, on top of that, add also artificial intelligence, that would help us finding those patterns and optimize medicine and other self-care activities. So with that, I would like to say thank you for inviting me again. And if you have, you are free to ask questions now. And if you have this, if you want to ask questions later, this is my contact information.
So, thank you very much, Hanna. It's very interesting knowledge you have shared with us here today. We will have time now for some questions. I don't have so many in the Q&A session here yet, but is it anyone that is in the Zoom context that would like to ask Hanna something? So please feel free to do that.
I have a question for Hanna. Hello, Hanna. Great presentation. I am amazed at what you do. I'm always excited about using my own health data, and I do measure a couple of things, and I know how difficult it is, in fact, even if you know your way around computers. Probably the most difficult thing for me is how you combine the information in medical records with the information that you collect, and how many doctors are willing to explore this with you. And then you touched upon AI. How do these tools that are out there work?
First, I would say there are not so many tools out there. And the cooperation with healthcare is mainly strained, I would say, because if the problem is to combine these kind of knowledges, and if my health data say that this is not, you say your study says something, but my self-collected data say something else, how can we move forward from this point? It's mainly met with the comment that my self-collected health data is not correct. So it's really tricky, and I think that's because they are so taught that the studies say the right thing. So we need to understand that the study says something from one perspective, and my self-collected health data say something from another perspective.
Yeah, and and I have another question, if I may. What can we standards organizations or FMI, as a professional organization of medical informaticians, do to help you?
Yeah, I think it's, if we go back to this slide with so many details, how could we create information structures that would help us to combine these kind of things? Because this is something you cannot do as an individual.
Mm-hmm.
So if it would be easier for me to understand the healthcare data structure, and then together, how could healthcare and people like me continue working with information structure for the left upper corner there?
Mm-hmm.
Interesting.
Thank you, Hanna. And I would like to follow up on this with the working group on citizens and health data of FMI, and Maria Haggard from the Swedish Association is actually the co-lead, and I hope that you can help us advance this figure. Thanks a lot.
Yeah, let's keep in touch.
Good. We have some more minutes left here.
Are there any questions from China, from the broadcast, maybe?
Yeah, actually, I have a question to Hanna. That since Hanna is discuss about the patient or the people health self-management to be a bigger complementary part of the like a clinical health support. So for the self health management, we have to, like you said, we use different devices, and we get the data, and the data will be structured. This kind of service, do you think the patient self patient self may not be able to manage it fully to themselves, or in a right way or a smart way to manage them? They, of course, they will manage them once they have the medical knowledge, some kind of basic knowledge of health. But this management need to be organized and to be managed. So your suggestion is we use this kind of infrastructures and this kind of data management to hold all the patient information, I mean the health information together to manage, to predict, and to do the service. What do you think?
I mean, people are very capable of finding, learning from their own data, but collecting it and things like that is very hard. It's like today we have internet, we use internet and doing all our banking errands over the internet.
Yeah.
So this is more like today I use health data as using a telegraph with the Morse alphabet. And I cannot stop using the Morse alphabet if there are not any common societal structure for health data.
Yeah, it's kind of management to make the patient self healthcare or self service more efficient, I guess. Yeah.
And make it possible, not just efficient.
Okay.
Because as of today, it's only possible for people that are very skilled in programming, and even for us, it's very hard and time consuming to do.
Yeah, if we can get those data and make them standardized and structured.
Exactly.
Yes, thank you.